Okay, so now we conclude and we compile the mechanism of loop diuretics. There are total 4 mechanisms. First major mechanism is they inhibit NaCl reabsorption from the thick ascending limb of loop of Henle by inhibition of sodium potassium 2 chloride symporter. And that is a major mechanism because 90% of the NaCl is absorbed from this site. Okay. Second mechanism is it is also weak carbonic anhydrase inhibitor. So by inhibiting enzyme carbonic anhydrase, it also produces diuresis. Third, it also induces the synthesis of prostaglandin E2, and that inhibits the reabsorption of sodium in the loop of Henle and produce diuretic action. And fourth, it is also directly secreted in PCT and blocks free water clearance. So by these mechanisms, it produces the diuresis action, and that is very highly efficacious. The pharmacokinetics, all the loop diuretics are rapidly and completely absorbed orally, and that's why they are majorly used as a oral drugs. But also they can be given intravenously. So whenever they are given intravenously, they act within 2 to 5 minutes, and when they are given orally, they act for 20 to 40 minutes. They start their action for 20 to 40 minutes. Okay, and they are extensively and firmly bind to the plasma proteins. So there can be drug-drug interactions with those drugs which displaces loop diuretics from the plasma protein binding. Okay, coming to the adverse effect of the loop diuretics. Adverse effects of the loop diuretics are, first one, hypokalemia and metabolic alkalosis. As we have seen in the pharmacological action part of the loop diuretics, along with the sodium and chloride, it also inhibits the reabsorption of potassium. So, and as well as that in case of collecting tubule, that unabsorbed on those sodium which are not reabsorbed, they are exchanged again with potassium in the case of loop collecting tubules. So more and more potassium is excreted out from the kidneys, and that's why it produces hypokalemia. So you can see the description here also. Because the loop diuretics inhibit the reabsorption of sodium in the loop of Henle, a high sodium fluid is delivered to the collecting duct, and in the collecting tubule, the potassium and H plus both are secreted in large amount in exchange with the sodium. So from that collecting tubule, sodium is reabsorbed in exchange with potassium as well as hydrogen ion, H plus ions. So more potassium is excreted out, produces hypokalemia, and more excretion of H plus decreases acidity and produces alkalosis. So the body's fluid become alkaline. So that is metabolic alkalosis. Now hypokalemia is dose dependent and can quite troublesome in higher doses on prolonged diuretic use, especially in patients who have low dietary intake of potassium or in patients with cardiac failure and cirrhosis. So, the hypokalemia is the major side effect of the loop diuretics, which must be regularly monitored during the therapy with loop diuretics. And the symptoms for the hypokalemia, when the symptoms are appears, normal levels of the sodium potassium ion in the blood is 4.5 to 5 milliequivalents per liter, right? So when it becomes completely to half, or you can say less than 2.5 milliequivalents per liter, then and then the symptoms of hypokalemia can be appeared. So the symptoms are irritability, the mood becomes very irritable, drowsiness, confusion, dizziness, muscle weakness, and cardiac arrhythmias. So when these symptoms appear, then there is a hypokalemia, the reduced potassium in the blood, and that can be treated, that can be corrected by three things. First, high dietary intake of potassium. Whenever the loop diuretics are taken, they are taken along with the diet which has the potassium supplement. Or second, if diet should not include the potassium, then oral KCl supplements are added. means the tablets of potassium or capsules of potassium are prescribed along with the loop diuretics. Or third option is by adding the potassium sparing diuretic. If you remember, in classification of diuretic, in case of low efficacious diuretics, there is a one class, potassium sparing diuretics. We will discuss it later on, but the potassium sparing diuretics does not allow to excrete the potassium into the urine, so that's why they retain potassium. So if the oral supplements or a diet cannot be possible, then loop diuretics are given in a combination with potassium sparing diuretics to prevent hypokalemia. So hypokalemia and the metabolic alkalosis are the major side effect. Second side effect is hyponatremia, dehydration, hypovolemia, and hypotension. Hyponatremia means reduces in sodium level in the blood. So that is quite common. As it increases the excretion of sodium and chloride in the urine and produces diuresis, then it reduces the sodium level in the blood. So if it is reduced in major amount, then it produces hyponatremia. And whenever the sodium leaves the body, at that time it also excrete out the more amount of water along with the sodium. So there is a reduced the volume of water in the body, and that causes dehydration. And whenever there is a reduced water amount in the body, obviously the blood volume is also reduced, because water part of the plasma is reduced, it's excreted out. So blood volume is reduced, which is called as hypovolemia. And because of the blood volume reduction, blood pressure also reduces, and that is called as hypotension. So the hypotension is the reduce in blood pressure. So when sodium is decreased, water is decreased, causing dehydration. Dehydration reduces blood volume. Blood volume decrease leads to decrease in blood pressure and causes hypotension. So that is the second side effect. Third one is hyperuricemia. As we have discussed in hyperuricemia, so that is also we have discussed in pharmacological action part, that it increases the reabsorption of uric acid. So whenever the uric acid is more reabsorbed in more amount, then it enters into the blood, and there is a higher level of uric acid in the blood, which is called as hyperuricemia. Fourth is hypocalcemia. Hypocalcemia, as we have discussed, occur only if the loop diuretics are used for a longer time. The treatment is very prolonged, because whenever loop diuretics causes the inhibition of the reabsorption of calcium in loop of Henle, but when that calcium reaches to the distal convoluted tubule in the DCT, it is reabsorbed from that site. So there is a less chances of hypocalcemia. But when the loop diuretics are used in for a prolonged time, the prolonged use, then they cause hypocalcemia. And when there is a reduced level of calcium in the blood, so the bone tries to maintain the calcium level in the blood by giving the calcium from the bone to the blood. So there is a reduced amount of calcium in the bones too, if they are used for a prolonged time. Then the bones become porous and may cause osteoporosis for the long-term use of the loop diuretics. The fifth side effect is hypomagnesemia. So that is also quite common. More amount of magnesium is excreted out along with the potassium, sodium, calcium, and chloride. So there is a reduced amount of magnesium in the blood. So that can be treated by magnesium tablets, magnesium supplements. Okay, the sixth one is ototoxicity. Sodium, potassium, and chloride co-transporter, which is inhibited by this loop diuretics, is also present in the inner ear. So along with the renal tubules, this importer is also present in the internal ear. And loop diuretics, as the main mechanism of the loop diuretic is the inhibition of this importer, it also inhibits this importer in the internal ear along with the renal tubules, along with the loop of Henle. So whenever this sodium potassium 2 chloride importer is inhibited in the internal ear, what it produces? It produces the toxic effect in the hair cells of the internal ear, and these hair cells are responsible for the hearing. Whenever these hair cells move, that hair cells stimulate the receptors, and that receptors pass the impulses to the brain and produces the hearing. So when these hair cells damaged, then there is a hearing loss. So these loop diuretics are associated with tinnitus and vertigo as the symptoms of ototoxicity. So these drugs produces ototoxicity. They are toxic to internal ear, and this is more common with the ithacrinic acid as compared to other drugs, other loop diuretics. So that these type of question can be asked in GPET, that the ototoxicity is quite more common with following loop diuretics, and the four examples of loop diuretics are given. In that, ithacrinic acid produces more ototoxicity, right? Okay. And the main thing should be taken into the caution during the use of loop diuretics is loop diuretics must not be used with other ototoxic drug. For an example, aminoglycoside antibiotic. The aminoglycoside antibiotics are those drugs which are highly toxic to the ear. So when loop diuretics are given with aminoglycoside, both are ototoxic, then there is a very much hearing loss, right? So that must be avoided, the use of other ototoxic drug along with loop diuretics. The next side effect is hyperglycemia and hyperlipidemia. Glucose level and lipid level is increased in the blood, but it is very mild at therapeutic doses. GI disturbances like nausea, vomiting, and diarrhea occur with the ithacrinic acid. Allergic reactions like skin rashes are more common with sulfonamide derivatives. Since all loop diuretics except ithacrinic acid are sulfonamides, they also produces the allergic reaction. Always when there is a sulfonamide structure in the any drug, they can cause allergic reaction. So all the loop diuretics are also sulfonamide derivatives, and that's why they also produces allergic reactions. And which type of allergic reactions? That skin rashes and eosinophilia, that level of eosinophils increases. But ithacrinic acid is not a sulfonamide derivative, that's why it doesn't produce allergic reaction. So this type of question can also be asked in GPET, that following loop diuretic does not produce allergic reaction. So again the answer is ithacrinic acid. The next side effect is weakness, fatigue, hypertension, dizziness, and muscle cramps. And these are mostly due to hypokalemia. And in cirrhosis patients, rapid diuresis may lead to the other undesirable consequences. So these are the side effects and adverse effects of the loop diuretics. Coming to the uses, the first use is edema. Whenever the term edema is used, edema, that means swelling, the accumulation of fluid at any site, any particular local site. So edema, whenever there is a swelling due to inflammation, so that volume can be reduced by increasing the excretion of the water. So loop diuretics are highly effective for the relief of edema of all origins, like if it is originated from heart, if it is originated from liver, or it is originated from kidney. Any type of edema can be prevented, can be relieved by the use of loop diuretics. And particularly the most common example is CCF, the congestive cardiac failure, or you can say CHF, congestive heart failure, because the as we have discussed, that congestive heart failure, there is accumulation of blood into the whole venous system, which is known as congestion, and these loop diuretics increases the excretion of water as well as they produces venodilatation, and that's why they relieves the congestion in the heart and the venous system, and that's why they reduce the congestion and improves the CCF. Second use is acute renal failure. Loop diuretic enhance the urine output and potassium excretion, and they are also useful in impeding the acute renal failure. What do you mean by acute renal failure? Renal failure is the kidney fails to excrete out the substances, but acute is for a short time. So whenever these drugs increases the excretion through the kidney, then the body's excretion becomes normal. But if it is a chronic, then the larger doses of loop diuretics are required, or it may not be cleared by these loop diuretics. So only these drugs can be useful for acute renal failure. Cerebral edema. Cerebral edema, the furosemide can be used as an alternative to other drugs, or it is used in a combination with the osmotic diuretics. Cerebral means brain. So there is edema related to the brain tissue. Whenever there is a CSF entered into the brain tissue and there is the swelling, then it is known as cerebral edema. So in that cases, furosemide can be used. The fourth use is the acute pulmonary edema and the acute left ventricular failure. When there is a left ventricular get failed, left ventricular has the role that passes the blood into the circulatory system. So when they fail, what happens? It cannot eject out the blood into the circulatory system. So left atrium cannot be emptied into the left ventricle. So if the left part cannot be emptied, then right part cannot be emptied. And when right part cannot be emptied, the whole venous system cannot be emptied. So again, there is a congestion of blood, and due to that, the fluid enters into the lungs tissue that causes the pulmonary edema. So that pulmonary edema and left ventricular failure can also be relieved by the use of furosemide. And the last use is forced diuresis. Forced diuresis means whenever there is we should produce the diuresis forcefully, means immediately, and particularly for an example in poisoning, whenever there is the poison entered into the body, what we do, if it is entered into the GIT, then we try to vomit out and expelled out the poison. But in same cases, if it enters into the any way into the body, then if we produces diuresis through the kidneys, they can be ejected out. So in poisoning due to drugs like barbiturates, salicylates, the furosemide is used with IV fluids. Okay, because furosemide, as we have discussed, it produces the diuresis within 2 to 5 minutes, so they can be ejected out very early. Like that, anion overdosage. Anions, which anions? Like fluoride, iodide and bromide. When there is a poisoning due to these three anions, furosemide can also produces the diuresis immediately and eject these anions into out of the body. So forced diuresis. The sixth use is hypertension. As we have discussed, by increasing the excretion of water, they reduce blood volume, and by reducing the blood volume, they reduce blood pressure. So in case of hypertension, they can be used to reduce blood pressure. And the seventh use is acute hypercalcemia and hyperkalemia. Loop diuretics enhance the excretion of calcium and potassium, and that's why if there is a higher level of calcium in the body, it is known as hypercalcemia. So to treat that hypercalcemia, and when there is a higher amount of potassium in the body, that is hyperkalemia, these drugs can be used. Okay, so there are 7 uses: edema, acute renal failure, cerebral edema, acute pulmonary edema and acute left ventricular failure, forced diuresis, hypertension and hypocalcemia, hypokalemia. Okay, so till that we have discussed the mechanism of loop diuretics along with the other supplementary mechanisms, or you can say pharmacological actions of loop diuretics, the adverse effects of the loop diuretics and the therapeutic uses. So here we are going to end with the loop diuretics. Thank you.